Welcome everybody to the Pre-PA Group TED Talk. We are all third-year PA students at the USC PA program. My name is Valerie Brito.
My name is Bernadette Gonzalez.
My name is Shireen Hideri.
My name is Myrna Molina.
My name is Melissa Real. Welcome.
So let's dive into our project. The idea and passion behind this project came from the challenges we ourselves faced as pre-PA students. Do you remember the struggle? Calling CASPA because of horrendous manual transcript entry, calling individual programs because information was unclear. So, with the considerable struggle that we faced throughout this process, we wanted to make it much easier for the next generation of PA students. Our goal was to provide pre-PA and pre-health students with more information about the PA profession and provide more resources regarding the PA application process in hopes to increase the amount of PAs in primary care. We came up with a few ways to accomplish this. We increased knowledge of PA profession to undergrads during a pre-PA one-day conference, which we live streamed to increase attendance. We put together an application-ready checklist to make the application process more manageable. We addressed barriers to application process by providing resources, tips, and tricks. And we provided a website that students can reference with updated resources to address sustainability efforts. What's the real problem? Undergraduate students need information about the role of PAs in primary care and advisement on the PA school application process. Our needs assessment showed that pre-PA students struggle with the PA application process. By mentoring them, we can address the shortage of primary care providers.
Our efforts are validated by research literature like one put out by PAs out of Midwestern University that provides statistical proof that Hispanics and students of families of lower socioeconomic status are more likely to go into primary care. Another study by Mr. Ewan, who studies PAs and primary care, collected data with similar evidence, showing that PA students from underrepresented minorities, geographic origin, and low family socioeconomic status express greater interest in practicing in medically underserved areas. In addition to this literature, our government has laid out some objectives that line up with our own. Specifically, Healthy People 2020, AHS 4.0, aims to increase the number of primary practice providers, as well as AHS 4.3, which aims to increase the number of practicing PAs. Our needs assessment, polling current first and second year USC PA students, showed us that 40% needed more guidance with prerequisites, more than half needed help with the application process, and 63% with patient care experience, personal statement, and interview tips. From all this, we learned that PA students face multiple barriers during the PA application process. Thus, we designed our intervention to achieve objectives in increasing the understanding of what it takes to get into PA school, as well as what the PA's role is exactly, in hopes that we can promote students into the PA profession, into primary care, inherently targeting primary care provider shortage. As a group, we agreed that the pre-PA conference with student resources, student, faculty, and professional panels that was done by the previous pre-PA ATED groups was and is a great way to take down the most important barriers for undergraduate students interested in our profession. Previous ATED groups did a great job at laying the foundation and building a strong partnership with USC Pre-Health Advisement. They were able to get out some great resources to pre-PA Trojans. However, this year we knew that if we wanted to meet our objectives, we would have to expand our conference to non-USC students. We took a good look at this, as well as some SPA demographics, to better target pre-health students in underserved areas. SPA data indicates that USC is in SPA 6, and our neighbors over at Cal State RLA are in SPA 4. Both are identified as medically underserved communities and health professional shortage areas. So we targeted pre-health students at both these schools. But along the road, when our intervention was switched to a virtual conference, we were able to get the approval needed to expand our conference to more than 10 community colleges and universities.
We performed the smog readability test on pre and post survey questions to meet 9th grade literacy level. We realize that 6th grade literacy level is ideal when incorporating health literacy. However, since our target audience is undergraduate students, we are confident that the questions are well understood. In our intervention, we refrain from using complicated medical terminology and explain any abbreviations that we use. This is to prevent any miscommunications or misunderstandings. In our pre and post-test surveys, we ensure to include demographic information that ask about ethnicity and racial background. We wanted to help better understand our participants. We invite a diverse panel of speakers, including PAs, PA students, and Dr. Bakshande. We advocated for pre-health and pre-PA students by inviting school clubs to our conference. We wanted to bring awareness of the PA profession and presented the PA scope of practice and the role in healthcare. The panel of PAs and Dr. Bakshande, who is a PA advocate himself, talked about the PA's role on the healthcare team and in various capacities, as well as the future of the PA profession.
With the help of USC Pre-Health Advisement, flyers and emailed invitations were sent to pre-health students all over California. The USC Pre-PA ATED group held its 4th annual PA and Primary Care Career Day on Tuesday, March 31st from 1 to 4:30 via Zoom virtual conference. We had 140 RSVPs, about 74 active participants from USC, UC Irvine, Cal State LA, Cal State Dominguez Hills, CSUN, ELAC, SMC, Moore Park Community College, San Diego State, CSU Channel Islands, UC Berkeley, and UT Houston, in addition to USC PA faculty, alumni, and practicing providers. Participants learned about the profession and heard from PAs and physicians who spoke about experiences while working with one another. We also reviewed the PA school application process in general and gave specifics about USC's admission process. We also hosted a student panel with current PA students and USC alumni who were there to answer any questions that the PA health students had afterwards. During our conference, students were introduced to our updated trojanpa.com website, where they could find resources we made available, information about the admissions process, links to relevant associations, and brochures and graphs, some of them from AAPA and some originals made by members of our group.
In order to determine the success of our intervention, we created our pre and post test in a manner that would allow us to determine whether or not we made our objectives. The number of pre-test responses was 65, post-test 46, and the number of responders to both the pre and post-test was 45. This drop could have been due to the intervention being online and being over 3.5 hours. A little bit about our participants. As expected, a majority was female. 71.7 were between the ages of 18 and 22, with 20% being sophomores or freshmen. We were happy to see this because, as one of my colleagues mentioned earlier, we found out about the pre-PA career a little later in our studies. However, it seems we still have a lot of advocating to do because only 31.7 of our audience found out about the PA profession under 18. So maybe even considering a pre-PA conference of this capacity for high school students in LA would be amazing. Now to what we've concluded from our pre and post test. We broke down our objectives to make it a little bit more clear, and we also only used results from those who completed both the pre and the post exams. So, objective one. Objective one was created to ensure our audience knew how to differentiate the roles of a PA versus a physician or NP. We asked a series of true or false questions and measured the outcome in regards to the number of correct answers. As you can see from the graph, our participants already had a baseline knowledge of the PA profession. While we were able to clarify that PAs are not assistants and able to work in multiple specialties at the same time, we did fail to separate the scope of practice of an MD from a PA. This could have been because we emphasized that PAs can work in any specialty. Objective 2 was created to ensure that pre-PA students knew what PA schools wanted from their applicants. We asked a select the top 5 choices question about prerequisites. The rest of the answers were not necessarily required by all programs. Using the results, we tallied the number of correct answers and divided it by the number of total answers. 91.7% of the respondents were correct in the pre-test, and 93.2% were correct in the post-test. Overall, we see again that our participants had somewhat of a baseline knowledge, but we were slightly successful in improving the outcomes. Our objective 3 was focused on distinguishing direct patient care experience from healthcare experience. Using a method similar to objective 2, we were able to increase the number of correct answers from 76.5 to 81.7. While it was an increase, I did want to mention that I think we could have achieved a better outcome if we had mentioned some of these examples during our intervention. For example, medical translator was a popular choice, although it was incorrect. We did not mention this in the charts that we created. So next time thinking about placing that in there would be helpful for our outcome. Objective 4 was an important one for us because we felt overwhelmed by CASPA when we applied. Luckily, the CASPA application was still open, so we were able to provide them with a live share screen tour of the website using rolled over information. Again, we used the select all apply type question to measure if we correctly clarified the components of CASPA. We were able to increase from 84.2 to 95.3. Last but not least, Objective 5. Objective 5 was aimed at identifying a number of resources for pre-PA students. This was a free response question. The answers in the pre-test involved the basic information such as pre-PA organizations, school resources, and mentoring, but we're extremely happy to see that in the post-test, students mentioned the Trojan PA website, the CASPA Q&A section, and the admissions office of schools were also mentioned. It's amazing that we clarified that PA schools are more than willing to answer program-specific questions. We also added 2 important test questions not mentioned above in the objectives. And those were in regards to the likelihood to pursue a PA career and the likelihood to pursue primary care. As per these graphs, our group is extremely proud that we were able to increase interest in both of these aspects. Overall, we believe our intervention was successful. Nevertheless, there are aspects of our project could use improvement, specifically in meeting our objectives. The first to mention is simplifying our questions. With the select all that apply, we had trouble figuring out how to measure our outcome. Maybe switching to a multiple choice question would have helped. Secondly, as mentioned above, we could have used our objectives and our pre and post test questions to run through our presentation to ensure that we were indeed clarifying these correct answers. For example, with the question in regards to USC's program, we did mention it being a 3-year program, but we didn't clarify that it was a 33-month program specifically.
As was made clear from our data analysis, we made a substantial impact in improving the knowledge base of our pre-PA audience. Now I'd like to share some of their own words to drive the point home. A participant stated, "I enjoyed the panel and hearing from current PA students. I found that to be really helpful and informational. It made me feel more sure about applying to PA school and knowing what field I wanted to do. And I really enjoyed the panels. It helped answer some questions I had, but also helped confirm my decision to pursue a career as a PA." And finally, some remarks from one of our panelists to our group after the event. "I hope you all know how important it is to do what you did today, to provide guidance and inspiration for the next generation of healthcare providers, whether they become a PA or other healthcare provider."
When we first took on this project, we wanted to make a bigger impact by reaching out to more schools. While we had initially planned to change our conference to the USC undergraduate campus in order to increase attendance, the unforeseen circumstances caused us to quickly change platforms. Zoom allowed us to be more inclusive and invite more schools. Location, transportation, cost, and venue capacity were no longer a barrier. Our second star was finding a way to keep this project sustainable. We updated the Trojan PA website, created PA requirement checklists, CASPA timelines, interview preparation, and personal statement tips. We uploaded these files to Trojan PA website as well, so that all pre-PA students could have access to them. We also provided our LinkedIn information on the website so that pre-PA students can contact us if they have any questions throughout their pre-PA journey.
Our wishes. To improve, as Myrna touched upon, we wish to provide more guidance on how to get patient care hours, provide a session for mock interviews, and provide more time for participants to ask questions. Our final wish is for all the schools we were able to include this year to still be allowed to participate in the following years. For the first year ever, we were able to involve more than just USC pre-PA students and reach community colleges and even Cal States. Next year, we hope this project is continued in the Zoom live conference platform and that the team can improve the reach to even more students. So now, esteemed colleagues, we are days away from finishing our 3-year journey of PA school. Today, we wrap up months of works on our projects and begin to look towards our futures. But before you move on to saving lives, my group and I would like you to think back, way back to when you were mapping out your life and making moves to get you closer to acceptance to PA school. I am sure, like us, many face barriers on your journey to PA school. As many of us are aware, these barriers keep so many motivated students from getting accepted to PA school. Pre-PAs that come from underserved communities and from low SES backgrounds are disadvantaged going into PA applications, and this hinders communities with greater healthcare provider shortages. How? As we've said, if we mentor pre-PA students and empower them with the knowledge and confidence we now have as almost PACs, we can reach back and help catapult the next generation of healthcare providers by arming them with tools to succeed. Our call to action is simple. Don't wait for pre-PAs to seek you out. Instead, put yourself out there for them. Foster a mentoring relationship. Sign up to let them shadow you. Sign up for pre-PA panels when asked. You will be part of the domino effect that makes a difference in someone's life trajectory. And over time, we will see the healthcare provider shortage in primary care start to drop because you have helped grow the PA profession. Finally, we'd like to end by sending out our heartfelt thanks to all of our partners, panelists, and donors that helped make our project successful. Thank you all for your time.